All right, welcome everybody to the CARIE Health Care Provider Business Overview. My name is Jeff Giamalva. I am very excited tonight to be able to present to you a very unique opportunity when it comes to healthcare providers and really helping them solve problems. And I think that's really the essence of our new company called CARIE Health. CARIE has identified a problem, and we have a way to solve that problem, and it's called healthcare. And tonight you're going to get a lot of great information. I know we have two types of people on this call. We have people that are actively helping us build CARIE Health, and we also have healthcare providers, all specialties that are represented on tonight's call. And my name is Jeff Giamalva, and I am the Vice President of Sales for CARIE Health. And we're very fortunate tonight, everybody, to be able to introduce to you Dr. Dan McDyer. Dr. Dan McDyer is somebody who's an early investor within CARIE Health, and he is really leading the charge to help us bring this platform to practices all throughout the United States. And what I'd like to do is I want to give him the proper introduction. And I love what he says here. I love building things, marketing, identifying, and solving problems. Work ethic, energy, integrity. And I think that really sums it up of who Dr. Dan McDyer is. He went to the University of South Florida College of Medicine from '86 to '90. OBGYN residency in Jacksonville, Florida. Private practice, OBGYN in Mount Dora, Florida, from 1998 to the present. He's a Presidential Leadership Council member with Wellness International Network, showing physicians how to implement a nutritional supplement program into their practice. Board member, Florida Women's Care from 2013 to the present. Chairman, Section 2, District 12 of the American College of OBGYNs. President, Jacksonville OBGYN Society. Medical Director of Core Health Solutions. Founding investor of CARIE Health, and Clinical Innovation Officer, his official title with our company. And I am very blessed to be working very closely with Dr. Dan McDyer. He is somebody that is very busy in his practice, but he sees the long-term vision for CARIE Health, and no better person to really share with you that vision tonight than Dr. Dan McDyer. So, Doc, are you there?
Yes, Jeff, thanks so much for that great introduction. Man, I really feel completely blessed to have the opportunity to present this to you guys tonight. But just remember one thing, I had 4 hours of sleep last night. So if I start waxing on in the wrong direction, Jeff is here to reel me in. Jeff is the official fisherman to keep me under control. That's his new title with Virtual Care Partners and CARIE Health. He didn't know that he got into that job, but I sympathize with you, my friend. Anyway, the thing that's at the bottom of the bio there is the thing that's really got me the most excited right now. I'm very excited about everything else with my practice and everything. It's really growing. I can't believe after all these years it's just growing so quick. And I'm actually in Jacksonville, Florida now. I spent my first 4 years in the beautiful Central Florida area in Mount Dora, but now I'm in Jacksonville for 20 years now. I can't believe it. I actually had a patient the other day I delivered. I have many of those now. It's kind of crazy. It makes you feel like you're old, but I must have delivered here when I was 5 years old or something. But anyway, I've had this official title, this formal role with CARIE Health that I'm extremely excited about and extremely excited to share with you where this company is headed and what we've done thus far. As you can see, I've had that title for a grand total of 9 days now. So I am truly feeling like the magician who's been buried under 8 feet of sand trying to escape from the coffin. But I'm going to make it out because I see what is happening here, and I'm just so unbelievably excited to play a role in this on a more formal basis and a more integral role with the company, because I learned about this a little over a year and a half ago. The company at the time was called Epic MD. We've changed our name so don't get confused with that Epic electronic medical record company. And I was the first physician investor because I flew down to Miami to meet the principals of the company and was very impressed with the vision they were creating, with the people that had come together to launch this into the marketplace. And I kind of fulfilled the role. I kind of fell into it, just with the solutions and suggestions I was making. And I fell into the role of kind of like a consultant, just have weekly calls with them and things like that. And now I'm glad to be playing a more official role and having true input. And the thing that excited me the most is that as we go through this, you're going to understand this. Over the past 3 days, I've spent time on webinars with our development team who are actually putting together the platform we're about to launch on October 1st. And it was really impactful and gratifying to see that they had really taken into account all these suggestions I'd made. So it's almost kind of like I'm giving birth to my own baby. I don't have a uterus, thank goodness. But I deal with those all the time. I feel like I'm giving birth to something here, which is just incredibly exciting. So with that, I'm going to try to share my screen here, guys. This is where my skill set starts to drop off. I'm going to click share screen. And we're going to go to the actual presentation here. Bear with me for just a moment. And I hit play, and then there we go.
You did it, brother. Looks great. Perfect.
Man, that's good. I had one round of practice earlier today just to make sure, and that was with my Surface Pro. This is an Apple, so everything's different here. So what we're going to do tonight is we're going to help you step into the future of medicine and understand why you might want to consider joining CARIE Networks and implementing our technology platform into your practice so you can take your practice to the next level and be proactive rather than reactive to the market changes that are taking place out there, which we'll discuss some tonight. Because, most of us, we're working so incredibly hard in our practices, we don't know what's going on around us. And guys and gals, there are forces in the field, in the business of medicine, that are basically demolishing our patient care loop. They're stealing our patients from us, and you may not be aware of it, but it's happening every single day. And some of my colleagues think it's great. Hey, I get fewer calls in the middle of the night. My schedule's a little bit lighter. That's not how you build success. You got to maintain that physician-patient relationship and make yourself available. And that's what we're going to do. We're going to show you how you can use telemedicine to augment your practice and make it, something that patients seek out, make you something that patients seek out to obtain their care from. So just a brief little example as to how impactful this is and how useful telemedicine is. Just yesterday, I had a patient. She's from Orlando, Florida. She comes up to Jacksonville to see me, and she was flying to Germany yesterday afternoon. She works internationally, and she called with some symptoms that were a little bit confusing to her. And I told the staff, I kind of forgot she lived in Orlando at the moment. I said, just have her come in for a visit. We'll get her in. I'm one of those doctors who tries to get people in that day if he possibly can. I actually am kind of a martyr. I just crush my schedule and pay the staff overtime to stay with me late and stuff like that. Fortunately, I've got a very understanding staff who are on the same mission of giving great care as we are in our practice. But nevertheless, the patient said, well, I live in Orlando. I've got a flight at like 5 to go to Germany. And I don't want to see anybody here. I just want to see Dr. McDyer. So I said, we'll offer her virtual care. We'll see her virtually. So Anella just downloaded the app to her phone, requested an appointment with me, and literally within 5 minutes, she and I were conversing virtually. She got out of her car. She was driving on the way to the airport, hopped out of her car. We discussed the symptoms she was having. We determined what was going on, and I sent a prescription in for her that she's going to pick up on the way to the airport. So her problem was solved before she made an international flight. So that is the practice of tomorrow today, guys. And that is just the scenario patients are looking for: convenience, affordability, and accessibility. And with this technology platform and utilizing something that we are developing or something like this, but there's nothing like what we're developing, you are making yourself relevant. You're going to maintain relevance. So it's a solution to patient problems, and it's a solution to what many of our colleagues and you and I are experiencing as to how to maintain that contact with our patients. Now, by the way, I forgot to mention that I paid $59 to do that consult. Money right into my pocket, whereas in the past, it's always been free care. So, oh, look what I did. I started at the very end of the presentation. So, Jeff, you thought you did a good job. So anyway, that was a summary slide. So here's what's going on out there in the world, guys. Telemedicine is all over the news. When I became an investor in the company, I started mentioning this to my colleagues. Just the word telemedicine means something. They know it's something, my colleagues, but they don't know exactly what it is. And they need to find out real fast, because this is what's happening. The disappearing doctor, how mega mergers are changing the business of medical care. What's happening, guys and gals, is that there are partnerships developing that are people who are involving themselves in the delivery of medical care that don't belong here. I'm kind of, what I want to say, I want to maintain my business model. We are the ones who should be delivering healthcare, not mega corporations. And what's happening out there, these entities from outside the world of medicine are joining forces to start passing into our patient care loop. You've got partnerships between CVS, Walgreens, and a generic telemedicine company or traditional telemedicine company called Teladoc that are offering care to patients and keeping them out of your office. There's a partnership between MD Live, Walgreens, and Cigna. Once again, to steal those patients who are seeking care after hours or even during hours, and they can't get to your office to be seen, so they're going elsewhere. And the problem with that is that when a patient obtains care from one of the traditional telemedicine companies or from a minute clinic, 85% of the time, they don't come to see you and follow up for that problem, because the problem was solved by telemedicine or by the minute clinic. And that may sound appealing to some people who are at the end of their career that don't want to, build their business. They want to kind of fade off into irrelevance. That's not exciting to me, man. I want those patients to see me because I know they're going to get good care, and I want them to stay in my loop so I keep a patient population. That's how I make my living, right? So we don't want those entities interfering with the care that we're delivering. And this solution is how you break that monopoly they're trying to build. And here's just another headline from the Wall Street Journal, how telemedicine is transforming healthcare. I'll tell you that I just came back from Italy 3 weeks ago. And when the company was talking about offering me this position, I had the librarian in my hospital pull articles that involve telemedicine for the past 2 years that have been published in the medical literature. And she pulled 168 articles for me, and I read those while I was over in Italy. And it's amazing the amount of information that's out there in the medical literature that so many of us are unaware of as to how telemedicine is coming down the pathway to really change the face of healthcare and how it's delivered. And it has to happen, guys. We don't have a slide on it here, but healthcare is 18% of our GDP now. It's predicted to be 20% in the next 3 to 5 years. We can't afford that. And a lot of that expense is from what we were just discussing and describing. Patients seeking care, when they can't see their primary doctors or the doctors they have relationships with, they go to urgent care centers, they go to ERs, and they go to other traditional telehealth companies where they don't get to see their doctor. So it's very expensive to seek those brick and mortar sources of care. We'll talk about that in a few minutes. But here is where the experts and the analysts think telemedicine is going. We are in a business where it's truly in its infancy. Right now, there's about, look at the graph there. It's, maybe $25, $30 billion a year globally that are being spent on telemedicine. But this is just the beginning, guys. In another 7 years, they predict well over $110 billion globally being spent on telemedicine. And it's because it has to happen. That's why I tell my colleagues, it's not a matter of if telemedicine is going to occur. It's just when. And it's going to happen fast. And we're going to be a significant part of that with the model that we're putting together to help our physician partners basically, I would use the word market this to their patients to make them aware of what this platform offers. So why telehealth? Why is this something that really has relevance in the practice of medicine? Well, the studies all show that it has a potential significant impact. 70% of all acute care that's obtained in urgent care centers and ER visits can safely be handled effectively over the phone or via a video consult. That's amazing. Just think of that. 70% of those people that go to the ER and go to urgent care centers don't need to be there. And I know that for a fact because I'm one of those guys, probably like many of you, who takes the calls all night long and all day long too in the office and does that care for free. I don't do that anymore in the office with the virtual care that I've got, but I've done that for 25 years of my practice, and I've assumed liability, and I've never gotten paid a dime for all those problems I've solved. And a very brilliant colleague of mine who's on the board of Florida Women Care with me, she brought it to my attention about a year ago, and it's a real wake-up call. She said, Dan, that is your intellectual property you're sharing with these people. That's the only thing you have to get paid with. And I was like, wow, that is an epiphany. I never thought of it that way. I always just thought, I'm being a good guy and getting called at 3 o'clock in the morning and delivering free care for yeast infections been going on for 2 weeks. They call, 3, 4 in the morning, don't know why. So anyway, and a lot of the calls I get too, like for you guys, the patients just need peace of mind to know this is not an emergency. Just come to see us tomorrow in the office or in a couple of days. So 70% unnecessary visits that can be taken care of virtually. And 91% of people who obtain care via our telehealth model are very, very satisfied with the health care that's being delivered. The average cost of a visit to an urgent care center is $155. I can tell you that it's about 5 times higher than that for an ER visit. The average waiting time is 4 hours. In my city, maybe like in your cities, you see the billboards all over that say 15-minute waiting time to be seen in the ER at Memorial Healthcare Center. That's a bunch of BS. I found out what that means. That means when the patient shows up in the waiting room, a mid-level provider goes out and greets the patient, determines what their chief complaint is, and then guess what happens? This is the secret to why the hospitals are building ERs and urgent care centers all over the place. The hospital ERs are ordering every single test and lab that is relevant to that complaint the patient has. So they're basically padding their bill as much as they can. There's maybe a little element of malpractice, defensive medicine going on there, but they're just ordering every test under the gun. And my ER colleagues tell me, Dan, I can get the patients in here. I can't get them out of here. I'm waiting for all these test results to come back. So it's truly an abomination of the healthcare system. It's an incredible cost. Here's something else that you may have never thought of. 75% of most practices are closed after 6 p.m. And if you really extrapolate that out, think about how many hours a week are you available to see your patients in your office? It's only like 25% of the week. So 75% of the time, patients don't have access to you. So they have no choice but to either meet you via a virtual visit or one of your call partners virtually, or go to the ER or to an urgent care center, or to seek care in one of the other traditional telehealth companies. We don't want that to happen. And the reason that people are frustrated and are seeking other ways to be seen is that it's a 21-day average to be seen in a primary care doctor's office nationwide. It's crazy. That's just where it is. There's a whole host of things can be treated virtually listed over here on the right-hand side of the slide. That's a limited list. Essentially anything that doesn't involve a physical exam can be taken care of virtually, and that's how I use it in my practice. So telemedicine, as you saw in that graph that's growing exponentially, is basically a tsunami. And we are going to provide you with the surfboard so you can ride the wave rather than get crushed by it. And you definitely need to consider getting yourself involved with a telehealth platform. And we're going to show you tonight why we believe and we know that we have the most transformational and leading platform that's been developed coming our way on October 1st. So there are practices that do have telemedicine. My friend Maureen, who was actually telling me about my IP, she's used telemedicine in her practice before. She is a nationally recognized expert in sexual health and has patients all over the country that consult with her. Most of them have to fly to see her now because she quit doing the telehealth because the system was too expensive to run. The costs are significant. There are some that are inexpensive out there now, but they don't really help you run the system. There's no billing involved in the system. You have to chase your patients down to get paid because no insurance companies pay for this yet. There are ongoing maintenance costs. Like I said, no insurance companies reimburse for telemedicine. You've got to bill and collect it yourself. So it's very frustrating with the current platforms that are out there. So basically, Matt Wander and the core group of us at CARIE Health looked and evaluated the industry to see what all the weak points were and where the strengths that we could bring to this would be to make doctors more effective in delivering care to their patients, and at the same time make this a very valuable tool for the patients to use. So we want to, our main goal is to maintain and enhance the physician-patient relationship. And with that, we can create freedom of access for the patients and financial freedom for the physicians, because we make sure you get paid to do this. So our telehealth platform that we are about to release is absolutely free to providers. when you want to activate it, you can sample it for free, but when you want to activate it, there's going to be a small fee to get you credentialed, to make sure that all of your credentials are valid and real. There are some people out there that try to fake things. We still have that happen in Florida once in a while, for goodness sakes. It's a self-provisioning platform, meaning you download the app onto your tablet, laptop, desktop computer, and literally within 2 minutes, you can be up and running and doing telehealth. It's that quick. It's a seamless practice integration. There's the immediate opportunity to generate revenue from this, and you can share this with your colleagues and earn money from that, as we'll go through later on in the presentation. We actually truly brand you with your telehealth platform. We make it yours. We do email marketing campaigns for you to your patients to make them aware that you're offering this service. We have personalized enrollment sites for the patients to sign up with you to become members of CARIE Health so they can access your services. We have digital digital video brochures you can put in your office to make patients aware of what you're doing with telehealth, why, and how to use the telehealth platform. So it's a fully integrated turnkey system of implementation and marketing so you can become a successful telehealth provider to your patients. One thing that's very unique with our platform is it allows you to maintain contact with your patients. In the traditional telehealth model, Teledoc, MD Live, all those that are out there, there are probably 60 or 70 of them. When patients request a consult, they get a random doctor who they will never, ever, ever interact with again, unless it's just totally random chance that they get in touch with that doctor again. And they don't want to do that. The patients want to see you. They want you. You're their doctor. You have that relationship with them, that knowledge base about who they are. They want to see you. So our platform allows you to maintain contact directly with your patients. And the patients have access to you in several fashions. One is they can schedule a visit with you when your schedule's open for telehealth visits or virtual visits, or they can make an on-demand appointment with you. If you leave your schedule on your platform open for what we call on-demand patients, the patient can just request to see you whenever they want, and you see them when you're ready and when they're ready. They just leave the app on their phone running in the background, and when you're ready, you just log on to your desktop computer, whatever device you're using, and that automatically notifies the patient that you're there. It literally takes 15 to 20 seconds, and you're up and doing a virtual consult with your patient. And I'll go through some examples of that in just a few minutes. A lot of questions we get is, can mid-level providers use this? And of course they can. Our platform is simply a tool that allows communication to take place in a HIPAA-compliant, completely secure system. I guess that's how you'd call it. I'm not a tech guy. It's got complete cybersecurity, all that stuff that you need. So we are fully integrated into your practice with a HIPAA-compliant software program to allow you to communicate with your patients. When you're not available, this is what really allows, in my mind, a robust and complete integration of telehealth into your practice to make you available 24/7, 365, which is what the patients really need. Since we said a few minutes ago, you're only there 20 to 25% of the time in the brick and mortar setting. So you've got that other time when you're not available, but you can be available virtually, ideally. And if you're not available, you can turn off your system, but our system allows you to designate physicians who will take your calls for you. Whether you share a call with certain people like I do, I share a call with 3 other doctors. So when I'm not available, I will designate that one of those 3 people is on call for me that night. So my patients will always have access to me or a high quality physician 24/7. Now, if you don't have a call group that you share a call with, you can defer your calls to our cloud-based physicians. We have about 800 primary care doctors in the cloud, our virtual cloud, that are licensed in all 50 states and speak both Spanish and English. And your patients, if you're not available, will have their call deflected to the doctors in the cloud, and you'll have access to that care that was delivered to your patients. So it's as if they're still seeing you even when you're not available. So they're still in your system. They're not being extracted or stolen from you, or the attrition's not occurring from these other partnerships I spoke of a few minutes ago. So it's really ideal to create a fully robust practice. Now, what we do too, what's very unique, is we pay you to do the virtual calls with your patients. We have a billing system in place in the platform that when the patients make a consult, they put their credit card in there. There's no insurance involved because no insurance companies pay for this yet. So with the fee for service visit, it's $59. We, the company, CARIE, keeps $9 of that. You get $50. The patients also have an opportunity to become a member of CARIE Health, which gives them access to the full spectrum of doctors that are on our platform. If they're your patient and they happen to sign up because of your notification of the availability of the CARIE Health network, they use your ID code and you kind of get credit for their membership. And that's very important, because when patients sign up kind of under you per se, or through your ID code, every month you as the physician get 20% of their membership fee, which is $29 a month for an individual or $49 a month for a family of up to 5 people. And that gives them unlimited access to consults with the physicians, whether it's you or the doctors in the cloud or other physicians that are in our CARIE Health network. So that's really important. When I first learned of this model a year and a half ago, when I flew down to Miami to meet the principals of the company, I was a little concerned about the fee and the membership model, because there's less and less discretionary income. At least at that point in time we've got a new economy now, thank God, and things are recovering very rapidly. And I think there's more discretionary income. As a matter of fact, I'm doing more surgery now than I've done in the past 5 or 6 years. It's crazy how people they're very sick when they come in for their surgery. They've got that money to pay for it now. They've been putting it off for a while. That's a little aside there anyway. So when I got home from that visit down to Miami, what I did is I wrote up a 1-page description of telehealth, and then I put into that letter, or that survey that I was preparing, what was on that 1 page on the right-hand side, all the symptoms and problems that can be taken care of virtually. And then at the bottom of the survey, I wrote to the patients, this membership will cost $29 a month for an individual, $49 a month for a family of up to 5. Will you consider signing up? Yes, and if no, why not? And over a period of 6 or 7 weeks, I collected 564 surveys from the patients that were in the office. These are verified surveys. The patients are actually patients in the office. And I was shocked, guys. 30.96 or 31% of my patients said they wanted to become members of CARIE Health. Unbelievable, because I have the full spectrum of all socioeconomic statuses. I've got the people who've got nothing and just barely qualify for getting Medicaid, if there's such a thing, all the way to I live on the beach, I've got a $20 million home in Ponte Vedra type of people. So 30.96% of those patients said they wanted to join. And actually, shockingly, some of those were the Medicaid patients. Some of them were Medicare. It was a very diverse mix of who wanted to become members. It's not just isolated to the people who've got a lot of money and discretionary income. People understand the importance of accessing their doctors. So that was very, very eye-opening to me. And if you think about that in a few minutes, what would you earn if 30% of your patients signed up for memberships and you're getting 20% of their monthly membership? We'll go through a pro forma in a few minutes. So actually, there's me. They mocked up I guess that's an iPad there with my image on it of my personalized site when patients request care for me virtually. And I'll go through the scenarios to how this happens, guys. The patients simply download the app, and when they download the app, they have my ID code if I've made them aware of the CARIE Health network, and that gives them direct access to me. And so what they do is there's an app in their phone. They just tap the app. They put in some demographic information, what their current problem is, and then they request a visit. And if I happen to be active or online at that point in time, for what I just do right now is on-demand visits. I open up my schedule certain times of the day, like at lunchtime and after hours, for on-demand visits, because I like playing with this system. I like serving my patients well. And when the patients request a visit, I get a text message literally within microseconds that tells me that there's a patient in my virtual waiting room, and it's time to be seen. So all I do is I log on to my site on my desktop computer, or even my phone. My phone will work. And then I tap the little camera icon that appears on the screen. I don't think we have that on here. There is something here on this screen, but it would be start call if you can see that little blue button there. That's what the new platform is going to look like. And there's about a 10 to 15 second delay as the system checks the internet connection and the download speed to confirm that the call can take place. And then literally my image appears on the screen. The patient's notified that I'm there. She, because my patients are all she's, she opens up her app and boom, we're conversing. And my average consultation takes 9 to 11 minutes, and that's from start to finishing up writing the note. And actually in this platform or with our technology, there's a soap note skeletonized out there for you to write your note there. So you finish that up, close out the visit, and you're done. And you get $50 for that. Pretty cool. And the patients are really happy too. I mean, it's unbelievable the responses I get when patients do this. And I'll tell you the truth. I offer this to every patient that calls in with problems. I don't treat problems over the phone anymore. I will not do that. And that's a decision that we will help you make in your practice. You feel a little guilty about it, but guys, your knowledge base is so important and so valuable. Man, it's what you sacrificed your life for an undergrad. Stay in the lab when everybody's out drinking and going partying. So you get yourself in med school. Get yourself into med school, what do? You work harder so you can get a good residency. You sacrificed a lot to have the ability to deliver high quality care to your patients. You're worth people paying to see you. You've got to understand that. And it took me a while to get there. And now I know. So patients still, I offer them a virtual visit or coming to the office to see me and get their problem treated. And the majority still want to come to the office. Why? Because they don't know what telehealth is. But every patient that has done a telehealth consult with me says they'll never go back to coming to the office until they need a physical exam because it's so convenient. And I just can cite some examples. I had a patient on Thursday, 2 of them actually, on Thursday that requested virtual consults. The second one was the most interesting of the 2. She moaned and groaned to the staff about having to download more demographics into her site when she was opening up the app and didn't want to pay the $59 to be seen, blah, blah, blah. And finally she did it. And literally the moment my face appeared on her screen, you could just see her eyes go, wow, I can't believe this. She was in the parking lot of her apartment complex with her baby on her hip, doing a virtual consult about a bladder infection and a yeast infection. We got the problem resolved for her. And I told her, now that we're done talking, just go ahead and turn your app off. And that way you won't be seeing me while I'm writing my note, because I like to leave the platform open while I'm writing my note. It's just the most convenient way to do it at this point in time with the current system we're using. And I've been beta testing over the past almost year now. It was kind of funny. She didn't realize I was still viewing her. And she turned to her baby, like the baby knows what she's saying, and says, "That's the coolest thing I've ever seen. I can't wait to use that again." I was like, of course, it's just awesome, man. And it goes on and on like that. A patient, here's another great example. Over Christmas, this is kind of the nerd I am. I brought my Surface Pro with me. We were out shopping up in North Carolina over in Asheville. And my staff called me and said that one of my patients was suffering from some symptoms of mastitis. I delivered her like maybe 6 or 8 weeks beforehand. Maybe, actually, no, it was about a couple months. Doesn't matter. Anyway, this gal was when I came this close to kicking out of my practice like 3 or 4 times during her pregnancy, because she just, man, I don't know if anybody's ever given my staff that much trouble about money. My stomach would get knots every time she came in the office, just having to hear her complain about this, that, or the other thing, about spending money for this lab, this copay, that copay. So anyway, she had mastitis and I was on vacation. So she wanted to be seen. And my staff told her, well, the only way Dr. McDyer can see without you going VR is by doing a virtual visit. And she said, okay, I'll try it out. And man, I pulled over into the side of the road. We're in a UPS parking lot, a UPS store parking lot. I was mailing a present to a buddy of mine. And I just opened up my hotspot on my phone, opened up my Surface Pro, did a 5-minute virtual consult with her, got some antibiotics, called in. Man, I've never seen her happier in my whole life. She had a grin with the smile from ear to ear. It was unbelievable. She spent money to see me. I was so happy. I just jumped up and down in the back seat of the car. Of course, after we hung up, I was just like, man, I totally transformed that girl. That was just awesome. So anyway, the stories go on and on like that, guys. And the records really neatly are available here on the platform, the patients to go back and refer to so they can see what you discussed if they kind of forget, which we know, of course, they forget. So like I've been kind of focusing on, we have to understand to stop giving away our services. We're so important. And we can provide definitely a higher level of service to our patients by offering a telemedicine consult in the telehealth platform in our practices. So before we launch our the platform I use right now, guys, is flawless. It's not ever created a single problem. It's never malfunctioned. And it's very functional. We just stopped implementing it in practices because we're focusing all of our time and energy on our new platform that's going to take telehealth to a level never seen before. And before we launch that, there is an opportunity for you to earn money using the telehealth platform, just like I did a year and a half ago. Excuse me, when I surveyed my patients and all of them said they wanted to get that cloud-based care, 31% of them said that. We can still offer that right now. If you want to launch this, you want to get on a waiting list to launch this in your practice, and I say you need to get on the list because we just sent out a few simple emails a few months ago. We have like 12 or 1,500 doctors in the queue waiting to start this as soon as it's released. It's amazing the response we're getting. You don't have to tell them what it is. They just want to be on telehealth. So we have a 24/7 virtual solution for your patients. So when you're not available after hours, it'll still seem like they're getting care from you. They're getting care from the virtual cloud physicians that we have in our cloud. We have, like I said, 800 doctors that are there 24/7, 365 in all 50 states. So you can actually start earning money and getting prepared to launch this in your practice by offering our CARIE Health products, the $29 a month and the $49 a month membership to your patients. Really, why? Because they'll come into the CARIE loop of care rather than looking at the back of their insurance card and saying, oh, look at that, 1-800-TELEDOC. I can call and have a telemedicine appointment with some random doctor I've never seen before. You don't want them going there to their card. You want them coming to CARIE Health using our doctors, and once you're integrated in the system, they'll be right there for you. So the patient benefits, of course, this goes without saying, but just to highlight it again, patients are demanding convenience, affordability, and accessibility. I don't know about you guys. I feel so guilty about the stereotype of a doctor making patients wait to be seen. It just happens by default. If you're really trying to take care of everything the patients come into the office with, all the problems they unload in your lap, and not just sending them out and saying you got to come back to be seen, you get behind. It's impossible not to let that happen. I've lost years of my life making people wait. But when we have the telehealth system, all the patients have to do is request a visit, and they just wait for you in the background. And when you're ready, you just click on your desktop, and then boom, you're having a visit with them. So it eliminates that. And it's kind of funny to me when some of the patients, like I had one about 2 months ago who complained about the cost of the telehealth visit, and she obviously didn't understand the unwritten costs, the unrecognizable costs of the office visit. She came to the office, she had a bladder infection, came in, so she drove to the office, left work, drove to the office, missed work, found a spot in the parking lot, which takes time at the hospital office sometimes, waited 30 minutes in the waiting room to be seen, then waited 15 minutes in the exam room to be seen. I fixed her problem, got her some antibiotics, and then she left with what? Her deductible, which was a $75 visit instead of a $59 telehealth visit. Not to mention all of the time she wasted that day to come see me. I'm fine with that, though. I actually made more money. It's not all about the money, but that's just the kind of the funny thing about the whole process there. So it's a very low cost, $49 a month for a family up to 5, $29 a month for an individual. There are no co-pays. It's unlimited visits. It's accessing the cloud care right now, 24/7, and you soon, and you can rely on the cloud to back you up at night and on weekends if you don't have a call group with whom you share a call. So with CARIE Health, you have an incredible opportunity to add value to your practice, regain control of your practice, and protect yourself from those forces out there that are trying to steal your patients. There's attrition happening, guys. I feel it. I was on call this whole weekend, and I'm going to knock on wood on this one. I got only 2 calls in the middle of the night. 5 years ago, I would have not gotten sleep that weekend. 3, 4, 5 calls a night. They're getting the care somewhere else. They're looking on the internet, they're diagnosing themselves, or they're getting care at the Minute Clinic or from a telehealth doctor. And I have my patients telling me they're using TeleDoc and MD Live and all these other random telehealth care services. So regain that control and protect your practice, protect yourself, protect your livelihood. And with this, you're truly differentiating yourself from the other doctors that are out there. Not many are offering this yet, but patients will demand this as awareness is created. We, CARIE Health, are going to be the ones that create that recognition about telehealth because of the way we're uniquely marketing this through physicians' practices to their patients and also to the general population with our virtual care partner organization. So let's just talk a quick minute about a pro forma here, showing you how patient memberships can benefit you financially while the patients are benefiting from the accessibility to the care, the affordable care, and the convenient care. So I have actually a lot of patients in my practice. Between me and my partner, when we downloaded our demographics, we had, I think it was 8,000 or 9,000 active patients. We're just blessed to be super busy. And just think if 30% of those patients want to sign up as members of CARIE Health, the numbers are mind-boggling. But if you just have 100 families in your practice, a small percentage of your practice wants to become members of CARIE Health, that's $1,000 a month you're earning extra for doing nothing but offering a telehealth service to your patients rather than going elsewhere to get it. And they got unlimited access. And that doesn't take into account also the fact that's just monthly money that comes in because we're paying you to market our service to your patients so they become part of our network, which is you and us. Then you get paid $50 every time a patient makes a call or a consult. You have 100 single patients that want to get the single membership, it's $580 a month. You can see the numbers there. It's really quite amazing. And we don't have the slide here that actually truly discusses what you would get paid for doing the actual consults, which is $50 per consult. But just think about this for a minute. And this is why some doctors are actually leaving their brick and mortar practices and they're actually building a telehealth business for themselves online. They're going into complete virtual healthcare. Most of those are primary care doctors that are doing it. And the reason is that with our payment, you can earn a very good living. If I, like I told you, it takes me an average of 9 to 11 minutes to complete a consult from start to finish. That's from logging onto the system to finishing up writing my note. I can easily do 4 of those per hour. That's $200 an hour. If you extrapolate that out to 40 hours in a work week, that's $8,000 a week. And if you worked 50 weeks a year, that's $400,000 a year you're making by providing virtual care only. And you could do that. The marketplace is there and the opportunity to market yourself is there to become a 100% virtual care doctor. And guess what, guys? You don't have the 70% overhead that I have in my office to run this. All you have is a desktop. If you really want to do it right, you get a really high quality camera and some lighting in your room, and then boom, you're off to the races. No overhead. It's free. Costs nothing. That's all profit to you. So that's what we're trying to create. Is not a bunch of virtual care doctors that are just doing this 100% of their time. We want you to become relevant and keep up with the pace of change and get paid to do that. You've got to integrate some component of this into your practice. Otherwise, you're going to fall by the wayside. You're going to lose your patients. So with that, step into the future of medicine. Actually, this looks familiar. It's the first slide I showed. Step into the future of medicine and join CARIE Networks now. We're here to answer your questions. I really went on and on, guys. I tried to keep this to 25 minutes, but Jeff said, go for it, Dan, lay it out and run with it. So I hope my excitement was conveyed to you. We're here to answer your questions. This is just a taste of what we have to offer. This is actually what I would call our interim presentation. One of our physician members did a beautiful job of putting this slide presentation together. We modified it a little bit. I'm going to be changing it with Jeff and Lisa's help and with some of the corporate help to make it screenshots of how you can see each of the visits takes place step to step. It's going to be a phenomenal presentation. This was great too. I'm very privileged to be with you guys tonight. We're here to answer questions and help you get this implemented.
Great job, Dan. Thank you so much. And so here's what I want to do, everybody. I know the questions are they're coming at me like too much. So just hang on one second here. So first of all, this will be every Tuesday night for healthcare providers. Every Tuesday, 6 o'clock Pacific time. This will evolve, everybody, like Dr. Dan McDyer just said. Okay, it's going to evolve. We're gonna get into the weeds. But let me just get some simple questions answered. And Dan, we don't need to go on and on. Let's just go some simple questions. First of all, can you address malpractice?
Yes. Here's the shocking thing. In the history of telehealth, which is about 15 to 18 years old now. There has never been a lawsuit. It's never happened. Because why? You don't push the limits with this, guys. If the patients need to be seen, you just send them to the ER to urgent care if you're not there, or have them come to the office. You don't want to jeopardize anybody's health or well-being by trying to keep them out of the healthcare system when it's really necessary. There will be lawsuits eventually, and your malpractice, you would just call your malpractice company and let them know that if you're going to do random telehealth, that you're doing that. But you know what? You're doing it already. You're doing telehealth already if you're answering phone calls in the office and prescribing medications. So there's no change. It's just healthcare that you're providing through a different platform. So if you're just doing this in your practice, there's nothing to worry about. You're practicing in the scope of your care. I would check your insurance policy, but I can almost guarantee there's going to be nothing in there about offering telehealth to your patients.
Perfect. Okay, next, Stark Law.
Stark laws. Okay. I'd love to put on my lawyer hat, but my head might melt because I'm not one of those guys. So I can't tell you that, that I'm a lawyer. I can give you recommendations or anything like that. But that's a great question. It's very common that it comes up. Here's the scoop on this. We've done an incredible deep dive into the legality of all of this membership and sharing revenue with doctors. There is nothing to worry about since it's a cash transaction, and the fact that there are other components that patients receive or members receive for their membership. It's not just strictly to access healthcare. We have other things we're offering, and there we'll get into later on in future presentations. So there, as far as I know, and as far as our attorneys know at this point in time with the model the way it is, there is no reason to be worried about an anti-kickback law regulation violation or a Stark law violation. Nothing going on there. And actually, there is no federal money changing hands. There's no TRICARE, Medicare, Medicaid. There's no insurance company. This is all cash basis. So there's essentially no worry with that whatsoever.
Perfect. Okay.
But we'll get you details.
Here's the biggest one that keeps coming up. Okay. I'm not a physician. What about nurses, dentists, veterinarians, different specialties? Over and over again, I get this over and over again. Can you address that?
Can you see my slide?
Yes.
Fourth bullet point down. I actually spoke about it. But yes, like I said before, this is strictly a communication platform. It can be used to deliver healthcare or other things too, but we're using it for healthcare. So just like in your office, you let a mid-level provider see a patient, they can see a patient virtually too. As long as you're overseeing the care that's delivered, that's what makes that a valid and I guess legal relationship. So yes.
Yeah, I don't want to sound ignorant, but I know some people are going to ask, what's mid-level even mean?
Mid-level, I'm sorry. Yeah, great point, Jeff. It's PAs or physician assistants, nurse practitioners. If you have a nurse that interacts with your patients, nurses can't deliver healthcare though. They can only provide supportive care. So I would say that if a nurse is doing your virtual visits, we probably need to revisit the charge feature. That should not be taking place. As far as I know, we'd have to consult a lawyer on that. I'm not a lawyer, but I don't, from a quality perspective, I would not let that happen.
Okay, dentists, naturopaths, veterinarians. I know I remember I asked you that question about that today.
Absolutely, yes. And those are all sectors that we've thought about integrating into, certainly, because once again, it's just a HIPAA secure platform of communication. So veterinarians could use this, naturopaths could use it, as long as they're practicing within the scope of their regulated care. That's all that has to take place. We're strictly a technology company, allowing people to stay in touch with each other on a better basis and letting the provider, whatever that provider may be, get paid. If you're a doctor using our platform and you activate your system to be available and to get paid through us, we will credential you. We'll review your credentials to make sure that you're not masquerading as a physician, which will happen. There are going to be people that try to do that. We're not going to let that happen on CARIE Health Networks because we're actually partnered with the premier company that has credentialed over 100,000 physicians that have integrated telehealth into their practices or have gone completely virtual. They
Perfect.
actually left the company that was going to partner with us and became a division of us and invested in our company. That's how strongly they believe in CARIE Health and the model we're putting together. Very.
Perfect. Okay. You mentioned a credentialing fee. I got 4 questions about that. You said a small charge for credentialing. Can you address that?
I can't give you the numbers yet because we have to determine the extent of work that takes place to accomplish that task. That's on my list of things to do next week when I'm on vacation, to speak to Patricia, who is the president of the division of that company that joined us. So she's done it 100,000 times. Nobody else in the world has any more extensive experience. So we just have to find out what that is. But I know doctors hate to spend money, but I'm telling you, it's going to be worth every penny of whatever it costs, whether it's a couple $100 or whatever. I don't know what it is, but it'll be something, because we have to, if we're going to put you on our map and let people know that you're out there offering virtual care, and it's like a Google map, then we have to know that you're a doctor. We can't just put you on there and expect to have people be honest. Unfortunately, that doesn't happen. We want to control the quality.
Right. Okay. EMRs. How does it incorporate? When are you connecting or pulling up when a call starts? One assumes your EMR with all patients. I'm not sure the question. How does it incorporate with your EMRs? I guess that's the question.
Yeah, I understand the gist of that one. We have an open API with our technology, and we have the capacity to integrate with essentially any EMR platform that's out there. What I currently do is I usually use my Surface Pro or my desktop, and I just have my EMR system open in parallel with the platform here, just so I can go back and review some of the patient's information. If I need some demographics on them or some of their health history, if they haven't put that into the CARIE Health medical record, which they're encouraged to do. All the templates are there for them to do that. But we can integrate with the EMRs so that we can have bidirectional communication, and you can have your EMR and the Epic MD platform update each other. I mean, essentially in real time, but you don't want to do that. It's too much, maybe once a week or something like that. That's something we'll get into more detail on in the coming months to let you know how that offering will take place if people want to integrate that in that fashion.
Are the teleconsults recorded?
That is a question. In my platform, yes, and then it's actually up to the physician, your choice, as to whether you want to save that as part of the record or not. I have mixed feelings on that, honestly, because as most of you on the call probably know, that you're taking a patient's history and you're very intently listening to them, and you're writing down something or ingesting something they're saying. You're thinking, okay, what's my next question I need to ask so I can hone in on what the symptoms are. And they just in passing mention, oh, I got right lower quadrant pain, and then blah, 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 and it just gets lost in the mix. And then that become a piece of liability in my mind. You've treated their bladder infection, their yeast infection, then they end up with appendicitis 2 days. And so, I mentioned that to the doctor. You didn't address it, So I don't know that I want that a piece of my medical record or not. We can actually transcribe the entire event of the visit for you if you want. It's like a $1 a page or something like that, at least in the current platform I'm using. I don't know if we're going to continue offering that in the future. So anyway, I guess that's a long answer to the question.
Hey, Dan, I know you kind of addressed this, but Ashley wants to know if you know what is involved with credentialing. Are we putting that together still?
Well, that's already done. I don't know the actual details there, but if you're involved in credentialing in your practice, it's very similar, although we don't have to credential with an insurance company. It's just basically, I think it's called NCQA, but I don't know, whatever that thing is you're supposed to update every quarter with all your changes in your education, which never changes, where you're practicing, all that stuff, just all the things we can validate about your background and your licensure.
Is it NPI number?
Well, that's just a doctor's identification number. That's something we'll have for sure.
Yeah. So Ashley, it's all done. So if we could get that to you. So if we are someone on our staff sync and info carry Jennifer, so we or someone on our staff must sync the info from Carrie to our EMR. If via an API, why not synced simultaneously? Does that make sense to you, Dan?
Negative. I I can only tell you that it's something that can happen. Can't tell you how it happens. Don't know the answer to that. That's a tech team question, and we're not focused on that aspect right now. It's about getting the platform out first. That'll be something that is in the coming months after the platform is released. Yeah.
Perfect. Okay, guys, I'm going to take Kenny Williams' advice, and you're right, brother. We're going to cut this off before we lose the recording, and we're going to continue these questions. Don't worry. We're going to get this all answered for you. Stay plugged into all the upcoming webinars that we have. And once again, Dr. McDyer, record number of people on this call, and awesome, awesome job. Thank you very much, sir.
Thanks, guys. Everybody have a great night. Thanks for spending your time here.
Okay. Thank you, guys. Bye-bye.